Today's talk. It's Wednesday, the 24th of November. Now, we've got some things to discuss from Europe and things on longevity of immunity or the lack thereof today. But I want to start with Gibraltar. Lots of people have been asking me about Gibraltar, often as a challenge. They're uncomfortable with the high vaccination rate and the high infection rate, and they want to know what's going on, as indeed do we all. So let's have a quick look at that first of all. So Gibraltar, small island, bottom of Spain, top of Morocco in the Mediterranean. Well, it's actually more a peninsula. You can walk onto the mainland in Spain. British protectorate. So only just under 34,000 people living in Gibraltar at the moment. But it's administered 94,000 vaccine doses. And that's enough to have fully vaccinated 140.2% of the country's population. Now, of course, this clearly means that some people have had 3 doses. But as well as that, what happened was that there's about, I'm not sure of the figure, but 10 or 15,000 workers come in from Spain to work in Gibraltar, and the Gibraltarese authorities vaccinated a lot of these Spanish workers as well. But it doesn't alter the fact that Gibraltar is probably one of the most, if not the most, highly vaccinated areas in the world to look at. Face masks required in all shops and supermarkets, public transport, in medical centres, indoor funerals and at the airport. So still quite a lot of sort of public compliance with that in Gibraltar, we believe. But when we look at the cases, new daily cases in Gibraltar, well, the situation isn't really particularly good. So here we saw the early parts of the pandemic, February 2020. This was the increase in December 20, January 2021. Big increase, of course, as we know. Went down quite dramatically. But lately, there's no question we've got a surge here. There's a significant increase in cases, despite the very high number of vaccinations. And really all we conclude from this is that the virus can still spread to quite large extents in highly vaccinated populations. I don't really see any other conclusion from that. If you see any other conclusion, let me know. But we've got very high vaccination rates and we've got significant numbers of new infections. So no question that this is a remarkably disappointing finding. But here we have the figures for new deaths in Gibraltar. Now, if we look at that big increase there, sort of last winter, December 2020, January 2021, and then we look at the equivalent on the death rates, well, we see that into January, February, March, as we would expect with that kind of month's delay, the deaths went up about a month later. So that there we have the increase in cases, and then a month later, we have the increase in deaths, as we would expect for that delay effect that we classically saw. But now we are seeing the increase in cases. So there was an increase here, went down again there. That was sort of July, August, an increase here. But while we saw an increase in case after the surge last winter, now in the highly vaccinated population, we are not seeing the deaths. Now, what we have here is 4 deaths, basically since April, March or April 2021. Now, of course, this is in the context of a population of only 34,000. So it's got to be taken in context, but it's still a remarkably low number of deaths, and certainly a much lower number of deaths as a ratio to what there was in the past. So I think what we can say from Gibraltar there is it's remarkably disappointing. The Gibraltar figures surely show us that highly vaccinated populations can still spread the virus, because it confirms this idea that we're in an endemic phase now. The virus is going to be around for some time, unfortunately. But thankfully, it also shows that the vaccination is at least highly correlated with a reduction in deaths, and we've every reason to believe that correlation is in fact causal. Now, Europe, no question about it, things aren't going well as we head into autumn. cases are going up in many areas and anxiety levels are quite high in many European countries. Let's have a look at some of the data. So Japan we looked at yesterday, very low cases for comparison. New Zealand still low, Australia, Canada. So cases looking low there. United States cases are actually going up a bit at the moment. Now Germany, so this is the United Kingdom here, this line here. And Germany has gone up really quite steeply of late. So significant increase in cases in Germany. Ireland also quite high numbers, and Ireland, Netherlands and Belgium are fairly high vaccinated countries, and yet again we're seeing quite a lot of cases. Austria and Slovakia, very high numbers of new cases. So compared to the United Kingdom and the United States, quite significant issues developing in parts of Europe, looking like it's going to get worse. Share of the population fully vaccinated. Now it's not perfectly inverse. Of course, Slovakia is very high and Slovakia's got a very low vaccination rate. But as we saw, Ireland, Belgium and Netherlands had quite high rates of infection as well, despite having relatively high vaccination rates. Ireland, for example, we see that the number of cases have been increasing really quite quickly. So Japan highly vaccinated, then Canada, Ireland, Belgium, Netherlands, Austria, United Kingdom, Germany. Sorry, that's Australia there. Australia, Germany, Austria, United States. Australia's not in Europe, of course. It's just snuck in while I wasn't looking. But not a perfect inverse relationship. Some anomalous countries, Ireland, Belgium, Netherlands. But there is a trend there that the cases are slightly lower in countries with higher vaccination rates, and countries like Slovakia, low vaccination rates, a lot of vaccine reluctance there. Now this is the R value. Of course, we know this now off by heart, don't we? Anything over R is an exponential increase in cases. Anything below an R of 1 is an exponential reduction in cases. So this is the one line here. That's the one line there. So if we zoom in a bit now, just remembering that is the one line. So we see that Australia and Canada have got reducing number of cases. All of the rest are slightly on the increase or higher on the increase. So United Kingdom above 1, United States above 1, Ireland, Slovakia, Austria, Germany, Netherlands, Belgium. So pretty high rates of growth in Belgium, Netherlands, Germany, Austria, for example. And that line there is equating to 1.4. So that's a pretty, there's no question about it. This is a problem in these parts of Europe. Now, looking at the death rates, I think we'll look at the death rates today. So confirmed death rates. Now, Slovakia are appallingly high, unfortunately. Austria also, Austria, of course, going in, well, it is in a pretty strict lockdown at the moment, going into compulsory vaccination next year. But starting from the bottom, Japan, very low death rates, Australia, Canada, Ireland. Ireland could be picking up, unfortunately, because of those high number of cases. United Kingdom, Netherlands, Germany, Belgium, United States, Austria and Slovakia in terms of deaths. So difficult times ahead in many parts of Europe. That is unfortunately the case at the moment. Now let's go on and look at Europe in a little more detail. World Health Organization are saying Europe remains in the firm grip of the pandemic. In fact, there's more cases in Europe now, more new cases than anywhere else in the world at the moment. I think Europe really is the sort of epicenter of the pandemic at the moment. Death toll could top 2.2 million this winter. That's another 700,000 deaths in Europe by the 1st of March, is what the World Health Organization is suggesting may happen. And of course, this is based on quite a rigorous analysis. We don't agree with everything the World Health Organization says, but they do have good statos. And that is not an unreasonable projection, unfortunately, in Europe. So another bad winter. We were so hopeful that things would start to get better. High or extreme stress in intensive care units is anticipated by the World Health Organization. And this is a direct quote from their press release. In 49 out of 53 countries between now and the 1st of March 2022. So Healthcare provision-wise, there's no question it's going to be very challenging in quite a few European countries, on top of the massive waiting lists we already have. Now, we're hopeful that the United Kingdom is going to be better. We'll be looking at that in a minute. But Europe, definitely a problem. Director of the WHO for Europe, Hans Klun, face a challenging winter ahead. Yes, that's true. He's advocating the vaccine and the other measures as well. So the vaccine plus the other measures such as the mask wearing, the social distancing. For example, stating a fairly accurate study, actually, I'm not going to go into it in detail at the moment, but face masks reduce COVID incidence by 53% according to this study. And that means that over 160,000 deaths could be prevented by March the 1st in Europe if universal mask coverage of 95% were maintained. So this is what they mean by the vaccine plus approach. Now, why are we slightly more optimistic about the UK? Now, we believe that some interesting data is about to be released from not from Pfizer, from Oxford AstraZeneca. So this is the chief executive. Now, of course, we chief executives want to make their products look good, one would imagine. But we believe data's coming out on this pretty soon, and word is it's going to be quite positive. So UK is not seeing as many hospitalisations relative to Europe, despite high number of cases, which is good, as Pascal points out. And this is related to long-term immunity after antibodies wane. T-cell immunity. So as we've looked at many times, the immune system is multifaceted. Antibodies are often produced fairly quickly, but we know they wane after a few months, whereas the T memory cells, the memory B cells and the memory T cells, some of those can stay after some infections for decades, for many decades. So the memory T cells stimulated to recognise the SARS coronavirus 2 by the Oxford AstraZeneca vaccine may hang around or may be maintained for much longer than those produced by the mRNA vaccines. This is the data that's probably going to be coming out soon. Very interesting if this is confirmed, and it's looking like it's going to be. Looks like AstraZeneca initially gives higher levels of T cells. So the T cells are good because the T lymphocytes will, T killer cells, T cytotoxic cells, for example, will directly kill infected cells. But also they produce memory cells, which, as we say, can be there for years or decades. Now, if you remember the background to this, France, Germany, Spain, Belgium restricted AstraZeneca at the beginning to under 65s because they said, wrongly, that it didn't have good efficacy in the over 65s. And we had a president in France, what's his name? President Macron, saying that the Oxford AstraZeneca vaccine was quasi-ineffective. And really that statement was not based on data, as I understand it at the time, at all. So you got the impression there was a bit of politics going on. UK may have high T cells from natural infection as well. So that is ironically because we've been so laxed over the last from when did we open up? Was it June or July? So basically the later part of summer and autumn, there's been very few restrictions, which has allowed the virus to spread, which might have increased herd immunity. And also in the UK, we seem to have cross-infection from other coronavirus infections. Now, again, as we know, there's 4 coronaviruses that cause the common cold, and now the data that this causes some cross-immunity with SARS coronavirus 2 is accumulating. If you have SARS coronavirus, not SARS, if you have coronavirus common cold, the immunity from that probably wanes after about a year to 18 months. But in that time, you will have better immunity. So the combination of the Oxford AstraZeneca vaccine producing possibly longer lasting memory immunity, more natural infection in the UK over the past few months, and of course infection figures have been very high in the UK for some time, and cross immunity from other common cold coronaviruses might well mean that the UK does better, at least in terms of hospitalisations. So a government source, this is quoted in the popular press, well, the reputable popular press, but we don't know who said it. European leaders had all these unfounded concerns about AstraZeneca and its use in older people. Correct, they did. If you look at the data, you can see us using it early has been incredibly helpful in terms of protecting older and vulnerable people from the disease for longer. This does seem to be transpiring to be the case. So, not saying British authorities are particularly clever for working this out. It wasn't. We've been a bit lucky, but it does seem to be panning out nicely. Dr. Peter English, who was in charge of quite a few groups for quite some time, people whose immune system have produced a strong T-cell response but a weaker antibody response might be more likely to be infected in the first place. Okay, so there was apparently lower efficacy levels, but more likely to be able to fight the infection, and they would be much less likely to develop a severe disease, which is good. Although, I have to say that in Gibraltar, the majority vaccine there used was the Pfizer, actually. But there again, we see infections are increasing there now. So anyway, going on, Dr. Peter English, it's plausible that this generated an excellent T-cell response, which means that while people can still be infected and infectious, they can still pass it on, which is why it's now endemic. They're unlikely to be seriously unwell, which of course is what we want, and indeed what we saw in Gibraltar, although as we said that was the Pfizer vaccine. Oxford University, Professor Matthew Sharp. The best T-cell response seems to come if you give a first dose of the AstraZeneca vaccine followed by the Pfizer. Interesting. And of course, this is exactly what we've been doing. People who've had 2 doses of AstraZeneca are now getting 1 dose of Pfizer as their booster. And it does seem that this is probably generating the optimum response. So another reason to be optimistic. And Professor Dame Sarah Gilbert, one of the leading developers, of course, of the Oxford AstraZeneca vaccine, actually thinks the jabs may not be necessary. But that's not government policy. But it's an interesting point of view. Now, I think we'll have a quick look at the UK here. UK summary data. Let's just look at cases. In the UK, well, they're bobbing along and going up at the moment. So highish. But how is this transposing into hospitalisations, which of course is the key point? They're actually going down. So again, it looks like Gibraltar is a bit of a microcosm of the United Kingdom as a whole. And deaths in the UK, thankfully, well, no, they're still there, but they're much lower than they were, thankfully, but going down a little at the moment, but not massively. So we're seeing a lot of cases, but thankfully hospitalisations starting to drop in the UK, whereas hospitalisations in quite a few places in Europe are actually starting to increase. And let's have a quick look at the United States here as well. Cases in the United States, well, they are going up. There's no two ways about it. They are going up at the moment. I think it was 16% in the past 7 days. Just look at deaths, which have remained stubbornly high in the States, and but going down. That's good. That's good news. Let's see if we can get some healthcare graphics from the States now. Hospital patients. Are we going to get this? It's having a think about it. Perhaps we will. We are going to get it. Well, there you go. Going up slightly. Going up slightly at the moment. Okay, so that's sort of a useful orientation data. So that was the that one. So Centers for Disease Control, Rochelle Walensky. 7-day average up 18%. That was actually a couple of days ago. I think it's about 16% now. Hospital admissions also up about 6%, she's saying. 135 million people eligible for boosters. Wow, that is a lot. Heading into the winter months when respiratory viruses are more likely to spread, of course. And with plans for increased holiday season travel and gatherings, something like, I can't remember the figure now, but something like 2/3 of people in the States have said they have Thanksgiving as normal this year with normal family gatherings, which of course is wonderful. But it does mean there's going to be a lot of travelling. So she's right to talk about increased holiday season travel and gatherings. Boosting people's overall protection against COVID-19 disease and death was important to do now, as she advocates the booster dose of the vaccine. But then, again, CDC are saying in the fully vaccinated, and this way it gets a bit disappointing. Infections happen in only a small proportion of people who are fully vaccinated, even with Delta variant. Well, it depends how small you call small. It's not that small in Gibraltar. When these infections occur amongst vaccinated people, they tend to be mild. True, that's what the Gibraltar data would certainly show, and the UK data would certainly show. Although hospitalisations are going up somewhat in the United States. If you're fully vaccinated and become infected with the Delta variant, you can spread the virus to others. Well, yes, you can. So a bit disappointing. Now, briefly, because I'm going on a bit now, next spring, Anthony Fauci reckons that there's a Pfizer ongoing trial for vaccinating people 6 months to 5 years of age. And he thinks this will probably start next spring. So we're talking about next March, April, I guess, for vaccines to start in 6 months to 5-year-olds in the United States. Moderna and Johnson & Johnson have paediatric vaccine trials planned. So initially Pfizer, but they've got trials planned as well. Emergency use authorization would have to come from the Food and Drug Administration and then be confirmed by the Centres for Disease Control. So parents will have choices to make. And just briefly before we finish, Canada, going a very similar way. Health Canada, Pfizer-BioNTech in children 5 years to 11 is now their policy. 12 to 15s were already being vaccinated as from the 5th of May. So going down to 5 years of age in Canada, the same as the States, of course. In fact, the vaccine data in the States is, the figures in the States now are to show you that 74.1 of people aged 5 and over with at least one vaccine dose in the States is the way that is now being recorded. So Canada falling into line with the States. The Department of Health in Canada has determined that the benefits of the vaccine for children between 5 and 11 years of age outweigh the risks. 2-dose regime, 10 micrograms, which is a third of the adult dose, isn't it? It's 30 microgram adult dose Pfizer. 3 weeks apart. Still seems a bit, they don't seem to have extended that gap, but that's what they've decided to do. Immune response in children 5 to 11 years old comparable to 16 to 25. So 5 to 11s are getting the same kind of immune response as 16 to 25-year-olds. Of course, we await detailed safety data, but they must be happy with it because they're carrying on with that. The vaccine was 90.7% effective at preventing COVID-19 in children 5 to 11 years of age. That sounds high, but that's directly from their website. And they say, and no serious side effects were identified. Well, I mean, this simply is not credible to say there is none in the entire country of Canada. Why would they say that? I don't know why they would say that. There has to be some in the whole country of Canada. But they say no. Ongoing studies and real-world data, of course, is carrying on being collected on a rolling basis to ensure that the benefits of the vaccine continue to outweigh any risks. In other words, there's rolling, ongoing assessment. Now, if it does turn out that there's no serious side effects were identified, of course, we will be very pleased about that. But let's just watch that space for the time being. So, not good in Europe, the States, ongoing, Canada, ongoing, UK, slightly more optimistic in terms of hospitalisation. I mean, in the UK, it's about 95% of the population, I think, have now got antibodies, 93, 94, those kind of high percentages. So hopefully that's going to protect us from a severe winter hospitalisation surge, which some European countries are currently preparing for. So there we go. Mixed mixed messages today, isn't it? Mixed good and bad news. But thank you for watching.